One problem that I run into very frequently as a pain-focused peripheral neurosurgeon is patients who have had some kind of an orthopedic or spine surgical procedure who post-operatively may have severe pain or some kind of motor deficit. They have spine surgery, they wake up with a foot drop. They have a total knee replacement or a total hip replacement, they wake up with a foot drop. Even though the foot drop is, the inability to pull your foot up is the most dramatic obvious, so it'll often get termed a foot drop. Very often they have weakness with flexing the knee and pushing the foot down, etc. So all of these muscles in the leg that are innervated by the sciatic nerve tend to be weak. When that happens, spine surgeons, orthopedic surgeons really don't have an answer. They may have some idea that there's been a nerve injury. Oftentimes they'll just deny it straight up to the patient. They'll say, well, it didn't happen in the surgery. They hit that 6-month mark and then they go back to the surgeon and they're like, hey, my foot's still not working, or I'm still in excruciating pain and my foot's not working. They go through this whole course and finally the surgeon throws up their hands and says, well, it looks like it might be permanent, there's nothing we can do for you. If you're having excruciating pain that's pushing out beyond 8 to 12 weeks after a surgery, then most likely you're dealing with a peripheral nerve problem. Like maybe an infection, or a screw was put in the wrong place, or the prosthesis was too big or too small or something like that. Once they've ruled out all of those kind of problems that can be directly related to the surgery, and the patient is still experiencing excruciating pain or they're having motor weakness, if either of those symptoms are persisting past 3 months, the patient should really be referred to someone like myself who deals with these kind of peripheral nerve problems. If somebody wakes up from a hip replacement with a complete foot drop and at 3 months they're doing this, that may not mean that they're back to full recovery. Just because visually they can pull the foot up, if you actually do careful motor testing, they may only have like a 3 out of 5 or a weak 4 out of 5 motor test. For patients who don't have a lot of pain in conjunction with that kind of a motor deficit, often they're just told like, well, you're fine now. And they may feel lucky that they got not that much back. But when you test them, they're still weak. And that's because there's still a nerve compression that's compromising that motor function. If you've had spine surgery or orthopedic surgery and you're more than 3 months out and you're still dealing with horrible pain radiating down your leg, or some kind of motor deficit, a foot drop, a wrist drop, whatever the case may be, don't sit on it for another 2 years until it may be too late to do anything, especially in those cases where there's a motor deficit. You're sort of on a clock. The book says a year, sometimes it can be more, but sometimes it can be less. And at some point, there's enough damage that accrues to the muscle itself that even if you're able to restore the nerve signal, sometimes the function has been lost for good.